Is fluoride safe for you and your family? Does fluoride cause cancer, kidney disease, or osteoporosis? Is fluoride effective at preventing tooth decay? I'm Dr. Grant, and welcome to the first episode of Prevent. Today, we're talking about fluoride, and I really want you to know the answer to these three questions. Is fluoride safe for you and your family? How does fluoride actually prevent tooth decay? And what's the right level of fluoride you should be exposed to? Fluoride is a naturally occurring chemical, and it's found in the rocks, soil, water, and even the air. Fluoride is found naturally in water supplies across the globe in varying amounts. And when we talk about adding fluoride to the water, we're talking about adding very low doses so that it has the ideal anti-decay benefits. Have you heard the phrase, too much of a good thing? Well, it can apply to almost everything. So if you have too much fluoride, that's not good. Fluorosis, which is varying degrees of white and brown spots on your teeth, can occur in children when they're exposed to too much fluoride. In extreme cases, like those in parts of China where the level of fluoride that naturally occurs in the water is way too high, it has been shown to lead to lowered intelligence in children. So, let me paint this picture in another way. Imagine you have a headache. You take a couple of Panadol tablets, you lay down, you start to feel better. Suppose instead you take 100 Panadol tablets. What would happen? Your headache may become the least of your worries as you rush to hospital to have your stomach pumped. The dose makes the poison. Some people out there are worried that low doses of fluoride can cause things like cancer, kidney disease, and many other problems. Well, we have the perfect case study here in Queensland. Queensland didn't have fluoride added to the water until the last few years, whereas in most other states, the major cities had fluoride in the water in the 60s and 70s. The results? We simply do not see that other states have increased level of diseases when compared to Queensland, or in other areas of the world that have fluoridated water supplies. So rest assured, when water supplies are fluoridated to the ideal level, it's perfectly safe for you and your family. Tooth enamel is the outermost layer of your teeth, and it's even stronger than your bones. It's primarily made up of calcium and phosphate in a crystal structure called hydroxyapatite. When you eat anything that contains sugar, whether it's chocolate or noodles, even bread, the decay-causing bacteria in your mouth feast on the sugar and produce acid. This acid attacks your enamel and causes calcium to leach out. Fortunately, saliva contains calcium and other goodies that help to neutralize the acid and to replace the minerals lost during this acid attack. Now, when you drink tap water that has fluoride in it, or brush with a fluoridated toothpaste, the fluoride gets into your saliva. The fluoride then gets incorporated into your enamel and forms a much stronger compound called fluoroapatite, which is more resistant to the acid attack. And stronger enamel means less tooth decay. The answer is that individual needs will vary, but here's a good place to start. I recommend that you drink tap water, not bottled water, as it contains the ideal level of fluoride of around 1 part per million molecules, which is a very low dose. I recommend that adults use a fluoride-containing toothpaste with a concentration of fluoride of 1,450 parts per million. If you are an adult with an increased risk of suffering from tooth decay, I may recommend that you use a toothpaste with a higher concentration of fluoride in it, like this one from Colgate. Dentists can also apply a professional fluoride treatment, which has an even higher concentration of fluoride in it, which is even better at preventing tooth decay. If you think you're at risk of developing tooth decay, or you just haven't been to the dentist for a while, contact us at Method Dental. That way, we can assess your risk for developing tooth decay and tailor a preventative program just for you so that you can be cavity-free. So thanks for watching Prevent, and if you found this episode helpful, please like and share this video, because the more people we can reach, the more teeth we can save.